and welcome to another episode of Hashtag Ask the Experts, a platform made possible by the Namibian Media Trust and the DW Academy. Now, today we will be speaking to Christie Keulder, who is from Survey Warehouse, about the recent survey conducted between December 2020 and January 2021 by Afro Barometer. Now, the survey aimed to gauge Namibians' concerns about COVID-19 and the vaccine.
It's a pleasure to be here, and thanks for inviting me.
Thank you so much for being our expert of the day. Now, this survey, Christie, was conducted in a very unique manner. Let's start there. Perhaps you can tell us a bit about, this method that you used.
Yes, it's the first time that we've conducted an Afro Barometer survey via telephone interviews, which was partly prompted by the pandemic. And as researchers, we continuously have to find new ways to gather the information that's needed. So this is the first time it's been done. We used new technology to generate random lists of telephone numbers so that we don't have to scan open sources and so on. So people were interviewed using what we call CATI, computer to telephone interviewing software. So it's the first time we've done a sample of this size for Afro Barometer via the telephone.
Fantastic. And how many people were interviewed for this specific survey? Talk to us about the criteria or demographic, of the participants and how you went about, selecting them. Was it all random, or was there a system that you used?
No, we interviewed a total of 1,200 people, which for the Namibian population gives us a representative sample with sample errors of plus minus 3% on a 95% confidence level. And this is the sort of international standards for surveys of this kind. So we even though we changed the methodology, we had to make sure that we adhered to that. We employed a quota requirement for gender. So we had 50% men and 50% women. Telephone samples, of course, do have a form of bias because not everybody in the country has a telephone number, at least a cell phone number, and then not everybody in the country has coverage for cell phone networks. So with those things in mind, telephone surveys are generally for younger people and better educated people. So we have a slight deviation from a normal national sample on those two elements. So the majority of our sample is 35 years or less. And in terms of education, well over 80% either has completed secondary school or a postgraduate or a tertiary education.
Mm-hmm. You said 3% on a 95%. You say you use the word platform. I just want you to break that down into layman's terms for somebody that's
okay. So normally when people report survey findings, they always have to report a sample error, and that is a number, a positive or negative number, and they're the same, so plus or minus 3%. For example, say we report that on a particular question, 60% of the sample said that they would prefer vaccine A. With a 3% sample possibility, the true response is somewhere between 63% or 57%. So that's the plus minus, the range within which we could have an error, not more than that. So with a 95% confidence interval, we're 95% certain that the responses are somewhere between 63 and 57%. So that's basically what it means.
All right. And what were your primary focus areas of this survey? And also, why was it important to conduct a survey of this nature?
Well, we wanted to find out. Now, in the Afro Barometer context, first of all, we've done a number of countries. In total, we have about 38 countries in the network. We've done about half of those before COVID arrived. Then we had to suspend round 8, the remaining part of round 8, until it became safe again to do these face-to-face interviews. So by the time the second wave of the round 8 surveys were done, they'd already incorporated a number of core questions on COVID and the pandemic into those. So we have a kind of a situation where half the countries in the survey had not asked or had not been asked COVID questions and others did. So this was an experiment to see that should we get locked down again, could we continue doing the Afro Barometer survey with the telephone as the main tool for data collection. So the focus is primarily on COVID. In fact, I'd say about 95% of the questions are unique. In other words, questions that have not been asked by Afro Barometer before, with only a few of the continuing questions of the previous rounds. And we're starting as we speak. We're busy setting up for the planning for round 9 surveys to start later this year.
All right. And would you say that the telephone, the way, going about it via telephone and versus face-to-face, is this more effective or are they equally effective?
No, I think, this is a long and a very technical discussion to have. For most part, I think telephone surveys can be done reliably. It all depends on the country and it all depends on the coverage. Access to phones and then access to numbers. If we can continue with computer technology to keep generating random numbers, we won't exclude anybody deliberately from not being included simply because we don't know whether they've got a phone or whether they in fact have a number or are living in an area with coverage. So yes, I think telephone surveys are not ideal, but they're close to it for the circumstances. They're far better than internet polls, which people are very keen to do these days, I think, in terms of generating reliable data.
Yeah. You mentioned that you use a special technology to get these, access to the phones and access to these numbers for this demographic you were, surveying. Do you want to talk to us a bit about the technology that you use for that?
Basically, it's a computer program that allows you to import or lay down certain parameters. Every country's telephones or mobile phone numbers are generated by computers. And they have parameters that sort of specifies the factors that has to be taken into consideration when these numbers are generated. In other words, it excludes certain numbers, it limits it to a certain series of numbers and so forth. So once you could add those in, the computer can start giving you lists, numbers made up with those factors or those parameters taken care of. It's the same way MTC, for example, generate phone numbers, new phone numbers.
All right. I want us to unpack your key findings, and I have the news release that you have here. I want to go through it one by one. So the first one says about 9 out of 10 adult Namibians say they're somewhat or very worried that a member of their household will become sick with COVID-19. 86%, and that's 86% of them, and that the pandemic will negatively affect the country's economy. That was 94%. Their household's economic situation, 92%, and the future well-being of Namibia's children, 94%. Just take us through that first key finding.
Yes, basically what we're talking about here is we're talking about anxiety about the impact of the pandemic. And I think in the beginning, for example, a year ago, just after this happened, people were still debating, is it serious? Are they making it up? Is it just not another bad flu? And those opinions have changed. I think everybody now agrees in Namibia that it is a serious thing. So we don't have to debate whether it's serious or not. We know it is. And then people have a series of anxieties, things that makes them worry, things that causes them stress. And you can see that with the numbers, we hardly ever see this number of people agreeing on some of our issues. So for most part, the Namibian population is in agreement, also in their anxiety. Everybody has the same anxiety. They're scared that they will get sick and of course die. They're scared that their household's economic position would be negatively affected. And for many, it already was. there's a possibility that more of it will be affected and for longer. They're also worried about the economic circumstances in the country. We know that Namibia has struggled before the pandemic, but the pandemic has certainly accelerated the decline of certain sectors, for example, tourism. And they are, so I think in that sense, we can deduct that Namibians are fairly concerned about their own and the well-being of their country, and then the future of their children. You know that, for example, schools have been affected by the pandemic. Now there's a huge outbreak of COVID for the last few months among school children. So, you know, these are generally things that Namibians care about, and there are things that they're concerned about, all of them.
Also, the second key finding says 2/3, which is 65% of citizens, do not trust the government to ensure that any COVID-19 vaccine that is developed or offered to Namibians is safe.
Yes, I think that's the beginning of the part where we wanted to draw the attention, because we are now busy with a vaccine rollout, and we know that the vaccine is more or less key to the country's recovery, also economic recovery, but certainly health recovery. And so we wanted to find out how people feel about being vaccinated and about the vaccines in general. Now, what this finding says is that even though government may be able to tell people that the vaccines are safe, people don't trust the government. And I think that is a key issue. We've seen in the normal Afro Barometer surveys that the nature of political trust in this country has changed over the last decade or so. People have become more skeptical and people have become more cynical, and the amount of people that trust government a lot, what we call trusters, has been on the decline. And we know anywhere in the world, in a democracy, without trust, governance becomes extremely difficult and complicated. And I think what we're seeing here is one of those things. It's certainly not new. You know, there have been many cases where people have openly questioned government's ability to provide reliable information. And we see in this survey too that people don't trust, the majority of Namibians don't trust the official COVID statistics. So I think in that sense, we're beginning to see a picture where Namibians' distrust in government or skepticism towards government is beginning to make things a lot more difficult when it comes to rolling out vaccines.
More than 3 out of 4 citizens. But yes, please continue.
No, the point that I wanted to make was that, but it's not only in government that they distrust the quality of the vaccines, and they distrust the manufacturers of the vaccines. If you go further on, you'll see that quite a large number of people say that they fear manufacturers will test unsafe vaccines on ordinary Namibians. So those are all general issues around trust. I think we received the initial batches of vaccines, the AstraZeneca and the Sinopharm, came prior to, for example, Sinopharm being approved by the WHO, and AstraZeneca was still sort of clouded in this blood clot uncertainty. So we also received and started to roll out vaccines that internationally didn't have the best reputation for that moment, which I think contributed to what the way people feel about vaccines.
Yeah. Well, one of the more interesting findings was the large percentage of Namibians that believe that prayer would be a more effective method to fight this virus than the vaccine is. I want you to unpack that for us, but also tell us why you decided to pose that question to these participants.
Well, because we know from looking around the world that this has become a big issue, and it's often been cast as a science versus religion argument, which I think is confusing. I think it's muddling the discourse. It's certainly not true. If you look at Israel, for example, Israel was the first country that achieved herd immunity through vaccinations. despite being a very orthodox religious community. So there's nothing that says you should have one or the other. You can be a believer and get vaccinated. That certainly is the case. So we were interested in finding out to what extent Namibians do see this as a kind of a zero-sum game where you're either one or you're the other, but you can't be both. And that certainly seems to be the case. And funnily enough, this is a younger group of people, better educated, that still feels this way. Mm-hmm. So that raises questions about, again, the distrust. I'm not here to criticize people's belief systems, but I don't think being a believer in whatever preferred religion you belong provides any justification of not getting vaccinated. I think people are generally scared of the vaccines, and they are looking for all kinds of excuses to confirm their resistance to get vaccinated. And religious grounds is just one of them.
Mm-hmm, mm-hmm. You mentioned earlier that, they obviously mentioned, the participants, that they have distrust in government, but not only in government, but also in the manufacturers of these vaccinations. Did you uncover why this is? Is it due to misinformation, them being uninformed or ill-informed about the vaccine? Because with the rollout plan from government, with the rollout of the vaccines, there was also a plan to sort of highlight the importance, yes, of taking the vaccine, and also highlighting the pros of the vaccine, and just really giving the general information to the public on why you need to get vaccinated. So how is it that, why is it that these participants felt this way?
Well, again, I think there are many reasons. We didn't probe for it in the survey, so I can't give you a breakdown of specific reasons for the Namibian population. But we know misinformation is a huge issue. People releasing information which is simply not true. As to why they want to do it, I don't know. I think most individuals in this country has had some form of experience with vaccinations. We've all been vaccinated against a number of diseases way back in childhood already. As far as I also remember, I don't know if things have changed recently because I don't have children, but it was pretty mandatory for people to have these vaccinations, right? Polio and all these kinds of diseases. And we've managed to destroy these diseases. It took us a long time. So now all of a sudden we have this anti-vaccination sentiment and we're putting it out there. And sadly, even people in the medical field, some pharmacists, doctors, and so on, has joined this anti-vaccination crowd. The reality, however, is that all these things that Namibians seem to be concerned about, their economy, their household financial position, their children's future, are heavily dependent on vaccines. The time has come to realize, but you don't really have another alternative. This winter will be one of the hardest winters health-wise for this country. Mm-hmm. We have seen an explosion of death rate. We have seen a really sharp increase in new cases. Mm-hmm. And that has now started from a position where we were last year with the first wave. Last year's first wave numbers, around 200 to 300 people per day, is now becoming our norm. And this is the point from where we'll start. So it will go up. And in the end, the choice to get vaccinated becomes more and more difficult, because if you do not get vaccinated, first of all, the chances of you getting sick and dying, by the latest statistics, increases every minute that you go without a vaccination. Because vaccinations may not prevent you from getting COVID again, but it will prevent you from getting sick enough to go to hospital, and we know there's no place for you. Yeah. Right? The ICUs are full. You will have to go, and if you just watch some video material of what happens in countries where people don't find hospital beds, it's terrible. Right? You have to sleep in parking lots and all sorts of stuff. It's not nice. So unless we do a vaccination and we protect ourselves, but we also protect those around us, I have very little doubt that in the near future, countries will be allowed to open their economies based on the vaccination rates.
Yeah.
So we may have a situation where a country in Africa, for example, with a high vaccination rate, will be targeted by European countries for holidays and for travel, tourism.
Mm-hmm.
But countries with low vaccination rates won't. In
Mm-hmm.
fact, they will be prohibited from receiving people. So it's not about us. It's not about me individual. It's about us as a nation. It's about us as a community. It's about us as an economy. And it's most certainly us as a country. And right now, at the rate that we're taking up these vaccines, it may mean that we're in 10 years, we will still not have herd immunity. And how many new variants will come along, we don't know. How many more people will die, we don't know. But it's serious.
Yeah, yeah. My question about your participants sort of being, ill-informed concerning, the vaccine was really to gauge, because you did mention that these are, what was an educated bunch of people that you interviewed, more educated than the average person. So I wanted to understand what type of media do they subscribe to? Because now, if they don't fully understand the importance of the vaccine, like you've just nicely unpacked for us, is it because the media is not doing enough in terms of bringing forth the information that the general public needs?
Yes and no. I think the government's campaign during the COVID pandemic, especially the first part, setting up the communication center, doing the regular news briefs and updates, getting experts in to talk about COVID and the economy and so forth, I think that paid off. Most people in the survey said that they feel they're well informed and they approved of the way governments communicated with them. So I think kudos to government. They've done a really good job, much better than other governments. We know that social media and the internet has been the two most commonly used platforms for obtaining daily news. That was followed by radio and then television, and lastly, newspapers. Mm-hmm. Newspapers are still relevant in the sense that people consult with them, but more infrequently, not daily, more infrequently, say once or twice a week or so. I think it's not just the media. If I look at our sort of rollout campaign, it is still a bit of a mystery to me. I've not seen a published plan. Mm-hmm. I think it's not the media's responsibility alone. In this case, we need people to address the trust issues. Government's probably one of them. But I also see a need for civil society, our NGOs, our community-based organizations, and importantly, our faith-based organizations. Yes. We need faith-based organizations to come out in support for vaccinations. Anybody who's got a membership owes the country to work with that membership and convince them that vaccines can be trusted, that vaccines is the way out. Without vaccines, we have no way out. It's as simple as that. So that, to me, I would like to see more of the Namibian society getting involved, the organizational life, because they've been very absent. I've not heard anything pro-vaccination coming from churches. And I don't think one needs to ridicule people's reasons for not wanting to get vaccinated. I think it's all serious. If that's the reason you don't want to get vaccinated, I need to take that reason seriously, and I need to address that for you. Having said that, I think this is not confined to COVID only, right? Many of the public health programs that we run or has started to run in the past have run into this problem. Let's consider for a minute sort of the anti-smoking campaign, right? Mm-hmm. We know that from the anti-smoking rollouts that young people and old people are the hardest to convince to give up smoking. Young people say, I've got lots of time, I'll do it later on in life. And older people said, look, I've had my life, I don't care anymore.
Doing it too long.
So, so I think maybe we need to look at ways, more efficient ways, on how we can change people's minds. I think that's key.
Yeah.
Thus far, we haven't managed to do that.
Yeah, yeah. Christie, how will these findings from the survey be used?
Well, what we're trying to do is, first of all, we're trying to raise awareness about this issue. So we hope that organizations like those active in the NGO sphere would use this opportunity, and the data at least, to start launching their own campaigns. They know what the problem is, so they can address it a lot more clearly. We hope, and we've seen, that government has started to talk to churches and traditional leaders. So we need more of that. We're an organization that provides information, and the information is there. And we hope that the information will be useful to those who work on the practical side. And also, if people need more information about this, they're welcome to contact Survey Warehouse. We'd be happy to talk to them, and we'd be happy to share what we've got with them.
Yeah. Is the survey up, other than contacting you, is it up on a website where the public can have a look at it, at these findings? Is it available for the general average person?
Yes, we will put it on, it's on the Afro Barometer survey, the Afro Barometer website. It's available there. In terms of the physical presentation, it's quite large. So if people send me a mail, I'd be happy to return that to them. Or send it to them directly. It takes up a lot of space. But I think that the Afro Barometer website is probably the best place to find, well, at least the press release that you've released. We've already sent it out to many others. It's available through the media. So there's quite a big reach for it at the moment.
At the beginning of our conversation, you mentioned how you're planning to do another survey. Just talk to us about that and your plans around that, when it will happen, what it will focus on, etc. Well,
again, I take it you're referring to round 9. Well, yes. Yeah. One thing that we've learned is not to plan too much and too far ahead. It will be the 9th time we do the Afro Barometer. The survey was first done in 1999 in Namibia. So this will be the 9th time it's done. It gives us data for over a few decades. We normally go into a planning session, which means setting up questionnaires, reviewing questions, looking at findings, identifying new possible themes, and so forth. So I've only just received notification that we will start the planning soon. So I assume that perhaps if conditions are favorable and everything aligns well for us, the first countries, and again, I don't know when Namibia will be awarded the slot, but the first countries may go into field, say, by the end of the year, early next year, maybe. Yeah.
Well, anything in conclusion that you'd like to add on the survey that has been conducted and its findings?
I think, we will release more information over the next few weeks. There's more of our data that we will do. So it'll give us more opportunities to talk about this over a longer period of time. But thank you very much for affording us the opportunity to talk about this and discuss this important topic. I hope we help clarify some issues around the problems that we're facing.
Well, thank you so much for your time as well, Christie.
Thank you very much. Keep well and be safe.
Also, please note that this conversation will be up on the Namibia Media Trust YouTube page, so you can catch it. Thank you and bye-bye.